Hey, deserving listeners, it's just me today. If you were to somehow approach my supervisees and particularly my supervisees, I guess my students too, but particularly if you were to somehow contact some of my supervisees, people that new therapists that I'm supervising, if you were to talk to them and ask them in confidence what they disliked about me the most, there would probably be, a pretty sizable list because I have all my various flaws and any flaw you have is likely to emerge in supervision. But one of them would be that I will rant often about confidentiality and about how to follow certain regulations and standards of care when it comes to couples counseling, family therapy. And what they would say is, well, Kirk's always yelling at us about making sure that everyone signs the disclosure statement and never getting involved in the court and avoiding custody battles. And, whenever there's sort of different modalities of family and couples and individual, that we have to follow all these stupid rules. And the thing is that the reason why I'm annoying about it is because I am worried about everybody, because I have read many cases and seen many cases firsthand of therapists who make these mistakes and then end up getting in big trouble for it. And the instances in which you're going to get in trouble are rare. You could perhaps go your entire career without ever even having a complaint waged against you, let alone getting in a specific trouble like the kinds of things that I rant and rave about in terms of this stuff. But why take the chance when you can avoid it so easily? That's my whole thing. It's like, if you just follow a certain set of very simple rules, you can avoid a huge amount of headache and annoyance and sleepless nights worrying about it. But honestly, whenever I talk with people who are getting sued or having a complaint waged against them, the actual consequences aren't that big of a deal, which I'll get into later. But the biggest 99.9% of the toll it takes on a therapist is the waiting, the shame, the wondering what's going to happen. And, I have therapists, and I've been through it myself, where you're worried that a complaint is going to happen. You're worried that a client is going to go to the state licensing board and complain about you. The complaint hasn't even happened yet, and you're just worried they might do it, and that'll keep you up late at night worrying about things. There's just a special place in our brain for the anxiety of a therapist who is worrying about a complaint. It's very intense. I think it's because as therapists, we're all really dedicated to trying to make the world a better place, and we're very dedicated to trying to do well by our clients. And when there's the risk of a lawsuit or a complaint, it totally is antithetical to our life's mission. The other thing is that therapists, in my experience, even experienced ones, have a very loose grasp on ethics and legal issues. And when they engage in some kind of complaint process or legal process, they feel very insecure about their knowledge and about what's going to happen. And so that just raises their anxiety. So that's what I want to talk about today. I want to talk about a very common mistake of confidentiality that therapists will make that will land them in court or in a complaint hearing. This is inspired by a case sent to me by my malpractice insurance. If you've been listening to this podcast for a while, particularly if you're a patron, you know that I will get sent a newsletter. Maybe it's every month, every couple months, by my malpractice insurance, CNA, HPSO, who will send these cases and say, look about, hey, therapists, read this case in which a therapist was successfully sued and learn from the mistakes, please, because if you don't violate these things, then there will be less cases that we have to pay for, and then we can make more profits, essentially. Well, everyone wins if people read these newsletters. And whenever I read them, I think, man, I should talk about this on the podcast because there's so many little interesting details in here in this real story in which a therapist got had their license sanctioned, shall we say? And there's definite themes to these malpractice claims. They often involve a failure to have the right paperwork, a failure regarding not defining the client very well. And that's the one thing that my supervisees will say that I rant and rave about is, a supervisee will present a case to me and they'll say, so my client is a 14-year-old and I've been meeting with the parents as well. And I'll say, so the 14-year-old child is the client, and they'll say yes. And I'll say, and you've been meeting with the parents, is that right? Yes. And I'll say, and have you been providing any advice to the parents or any treatment to the parents regarding their parenting? And they'll say, yeah. Then I'll say, well, why are you calling just the 14-year-old a client? The parents are our clients as well. And they'll look at me like, oh, and I'll talk about this, I don't know, once a month. And the reason why it takes a while or never for my supervisees to really get it is because the rest of the world doesn't operate this way. There's this really, really stupid culture even in the field of family therapy in which agencies particularly, and I'm generalizing here, of course, there's certain agencies I'm sure that are doing a better job than others. But in my experience, these mental service agencies, I don't know the exact term, but mental health agencies that are mainly Medicaid or medical coupon clients will define the client as the teenager or the child, and the parents will come in and siblings will come in and maybe grandparents come in as well to family sessions, but the agency sees the child as the client and the other people as not the client. But if you're treating the parents or the grandparents or the siblings, then those people are also clients. And as systems thinkers, we're trained to consider we're trained not to look at the identified patient as the problem. Usually in families, the person who is identified by the family as the client is usually actually just the symptom bearer, as we call it, of the family system problem. So as systems thinkers, we're trained to look at the system as having a problem, and the system just identifies a scapegoat that they bring into the agency. And as family therapists, we're supposed to say, okay, well, let's look at the whole system here, and let's not blame one person for the family system problem. That perspective is not always helpful, but it often is, believe me. And for whatever reason, agencies don't go along with this, mostly because the Medicaid insurance system is based on an individual-based model and doesn't recognize system thinking, which is a shame. But the point is that there's all these problems in our culture regarding defining who the client is. And if that was all that was happening in our field, then I guess it wouldn't be that big of a deal. But the problem is when you actually go to court, they will look at things differently. When you go to a state licensing board, they will actually start asking questions that are in line with what I'm saying, which is you have to define the client properly, and you have to have the proper paperwork, and you have to consider a lot of risks involved in that. And so I'm going to go into all that as well. Also, a common theme to all these different malpractice cases that I talk about have to do with custody battles or submitting things to court or not consulting well or not having the right progress notes and stuff. So I'm going to go into that as well. All right. Welcome to the Psychology in Seattle podcast. I am your host, Dr. Kirk Honda. I am a therapist and a professor. This episode is just for patrons of the podcast. So if you're listening to this and you're not a patron of the podcast yet, this episode will end before the content begins. The content will probably be, an hour or so. If you want to hear the full hour-long episode, you have to become a patron of the podcast by going to patreon.com. That's patreon.com. Become a patron and you'll get access to hundreds of patron-exclusive episodes, including this one, in which we do deep dives into various different topics, not just therapist-related topics, but all sorts of things. And also remember that when you become a patron, part of your monthly pledge goes towards various charities that we support.